Hello everybody, I'm Ken Francis. I'm a California licensed marriage and family therapist. I really wanted to make a video about the ACA Fellowship, Adult Children of Alcoholics, and I wanted to be speaking directly to other therapists. I've been working in what used to be called the chemical dependency field, and now it's the substance use disorder field for about 30 years now. And I've seen a lot of changes come and go with trends, and even my own style and beliefs and way of working with my patients or my clients has changed and evolved over the years. About 10 years ago, somebody came up to me and invited me to speak at an ACA convention. They wanted me to present an intimacygram workshop, and I thought that would be a great opportunity to give back to the community and also get an idea of what the ACA Fellowship was about. Because my understanding of it back in the 1980s was that it was a bunch of wounded people sitting in a room holding teddy bears and crying. But that was before they had a lot of literature, including the big red book. And I was told, Ken, go to this convention. It's people are great. It's really good recovery now. So before I spoke in front of these people, I wanted to know who I was speaking in front of. So I went to a few ACA meetings, and I was very surprised at what I saw there. I was surprised at the organization, I was surprised at the recovery, and I was surprised at the growth that I was hearing from the people that were going to the ACA meetings. Since then, I've done a little bit more research on ACA, and I have been referring almost all of my clients and patients to ACA for about the last 10 years now. So now I understand ACA, I'm on fire for ACA, I send all my patients to ACA, and I noticed a lot of benefit coming out of this. However, other clinicians who I work with don't have the same understanding, and we're saying, whoa, Ken, back up. Why are you sending all these people in there? Too much, too soon. A lot of misunderstanding, a lot of lack of knowledge, and a lot of unwillingness to learn about the fellowship and see how our patients can actually benefit from this. The other thing that I've heard is people that are attending ACA come up to me and say, where can I find an ACA therapist or somebody that understands ACA principles? And there are therapists out there that do internal family systems therapy, maybe they do EMDR therapy, but they still don't have a knowledge of how the 12-step fellowship of ACA can be an adjunctive treatment for their patients. I know as therapists, sometimes we get territorial. Sometimes we have what we're focusing on or what our specialty is, and we think this is kind of the end-all for the patients. Whether it be doing cognitive behavioral therapy or doing internal family systems theory or doing DBT or doing EMDR. And I know I used to be like that. I used to think, you know what, let the patients work on their own recovery by going to AA or NA, but let me be the one to deal with the deep stuff. And I didn't realize that I'm not giving up anything by letting somebody go to ACA. In fact, what they're doing is they're doing homework. In between our sessions, they're doing more work. And I'm actually seeing accelerated growth with a lot of these patients. Now, some people specifically need trauma reprocessing, like what you get with EMDR. And I think when we have these specialties, we fail to realize that there's other things out there that really can support and help patients with their growth. And that's what I'm saying about this video, to realize how ACA and these other therapies can be integrated together to really help our patients and our clients. Now let's look into some of the pros and cons of why we would want to or not want to send somebody to the ACA Fellowship. One reason for not referring a patient to ACA that I hear often is it's too early, the person is too raw, they're too fragile, we're really trying to stabilize their drug or their alcohol use, and we just need to get them clean and sober for a few months or a year first before starting something a little bit deeper for them. So that's one reason. Another reason is just that it's too soon. Let's really work on the relationship. Let's work on what we're doing here within the clinic. Let's not refer outward yet. And if we do refer outward, let's keep it safe. Let's just keep it like Alcoholics Anonymous or Narcotics Anonymous. So let's keep that safe. Patients oftentimes don't understand trauma. They don't report having any trauma. They just say they had a wonderful or a normal childhood. Yet, if you have them read the ACA laundry list, they might relate to many of the 14 traits. But if they don't think that there's a problem because they had such a wonderful childhood, in spite of having all these traits, a lot of therapists are resistant to push the issue any farther. ACA as a fellowship also isn't quite as direct as AA or NA. And in AA, oftentimes people are instructed in the beginning to go out there and grab a sponsor, start working the steps immediately, and do 90 meetings in 90 days. It's a very directive, strong approach. And a lot of therapists like that directiveness. Another argument against ACA is that it has a lack of sponsors. It uses the fellow traveler model, and because there's not a lot of sponsorship, they feel that their patients are just going to flounder and not get the guidance that they need. Now let's talk about the reasons why we should refer patients to ACA. My favorite and foremost reason is hope. A lot of people come into therapy just drowning in shame and guilt. And oftentimes they're even struggling with their own identity and feelings of abandonment. And one thing about ACA is it takes the perspective that the individual is not the problem. You are functioning on the programming that you were given, and you are doing exactly what you were programmed to do. And if you don't like what's happening here, let's look at where that programming came from, and let's see if we can change that programming somewhat. To give people hope that, hey, you don't have to be like this. In fact, maybe this isn't your true self and who you were meant to be originally. ACA also has a gentler approach than the other fellowships. Instead of saying, hey, you got to do the steps and you got to finish this step by next week, it's all about going gently. A sponsor or a fellow traveler in ACA takes on more of a nurturing, loving parental role, working with the person, helping them at their own pace. And oftentimes with working the steps in ACA, gentleness breaks are recommended. When things start to get too overwhelming, instead of just pushing through there. And how many times have we had a patient who relapsed on step 4? Okay, very common. And that's the thing about ACA with feeling like people are gonna relapse as soon as they walk into ACA because it's too deep. Well, you don't start ACA or any other fellowship in step 4. And what I tell a lot of my patients and clients who have been in groups with me, a lot of my groups can get pretty deep. In fact, I think they actually get deeper than most ACA meetings. So if a patient is afraid that it's going to get very deep, I let them know that it's just the opposite. A lot of meetings are very, in fact, extremely supportive and uplifting. And an important part of the fellowship is working towards removing the shame, to acknowledge the existence of it, and to help support people into growing into their true identities. I work with a lot of people who are chronic relapsers, and I enjoy the ACA process, doing a lot of the ACA workbook work with them, because one of the reasons why they are chronic relapsers is because they have a core pain of abandonment that they've never addressed. And by having them go to ACA in addition to their AA or their NA, it really helps them to work on the core trigger that gets in their way of staying sober time and time again. And lastly, ACA is a fellowship that is full of what they call double and triple winners. Double and triple winners are people that belong to more than one fellowship. Oftentimes in ACA, there'll be a person who attends ACA, but also goes to Al-Anon and AA themselves. If I want one of my patients to connect with somebody at a meeting who also understands the struggle they're having to stay clean and sober, I tell them, speak up, because there's a lot of people in the room that know exactly how you feel and have dealt with the same struggle that you are dealing with. Don't feel like you're the only person in ACA that has a problem with alcohol or drugs. Once you speak up, you'll realize the room is full of them and they're there to support you. I like to front load my patients before I send them to ACA. So usually I let them know that meetings can vary. One meeting might have a lot of recovery and another one that they go to might have as much. The meetings might tend to be cliquish, or the meetings might be extremely small. And I caution them to pace themselves, always reminding them that the best way to start is just by reading the literature. Don't even work on the steps yet. Just start by reading the literature, and by all means, do not jump into step 4 immediately. Read the literature. Take it slow. Because I have so many of my patients going to ACA, I hear a lot of which meetings are good and which aren't, which is extremely helpful for me when referring my patients. Now, obviously they can go to any meeting, and a good thing now with virtual meetings is they can go to meetings any time of the day, all over the planet. So there's a lot of options out there for them to choose from. Those are the pros and cons. My final suggestion to you therapists out there is, as clinicians, pick up the literature. Read the Red Book, review the Loving Parent Guidebook. Maybe go to the website at WSO, which is adultchildren.org, and just read some of the literature on there and attend a few meetings. I think when we see exactly how this fellowship can help support the work that we're doing with our patients, we won't be so resistant to refer our patients to ACA. I have a lot of ACA and recovery related content on my YouTube channel. If you like what you heard today, please hit the like button and subscribe for more of this content. I'm Ken, and as always, thank you for watching.